All right, guys, well, welcome back to my YouTube channel. I know it's been a while since I've posted, but I'm going to do better this year. I wanted to start off by talking about just breast self-exams. I talk to patients every day, all day about this, and although a lot of our national guidelines in the U.S. states that women don't have to do their own breast exams, I see a lot of breast cancer patients, and I always ask them, how'd you find your mass, or how was your cancer diagnosed? And so often women tell me that, oh, I found my own mass, and so I think it's important to do self-breast exams. It's super duper easy. I'm going to walk you through it, and then next time we'll go over breast cancer screening, because I know it's been in the news a lot in the U.S. because we have some new guidelines that'll be coming out later this year, just about when women should do breast cancer screening and how often a mammogram should be done. But for today, we'll talk about the self-breast exam. And when you see your doctor in the office, what they do typically is a clinical breast exam, and that's when the doctor examines your breasts, asks you questions about, have you noticed any changes in how your breasts look? Have you had any discharge from your breasts? Have you had any pain in your breasts? All those things are very important. So when you do see your doctor for your checkup or your well woman exam, make sure if you're having breast changes or things that are different for you that you let your provider know. All right, so first we're going to start with this breast model. I've had this for many years, and most of my patients love using it. It's super easy. So I've got 3 of these, 1 in each room, and they have 3 lumps, so it's kind of a test. So I tell patients, most of my patients get 2 out of the 3 lumps. But when I'm explaining how to do a self-breast exam, this little model has 3 kind of ways to do it. The most common way is what I call the lawnmower technique. So you think about someone mowing the yard. You use the pads of your fingers and you just want to palpate the breast systematically up and down. And what you're looking for is any lumps or bumps that are new or different. I also tell patients there's breast tissue in the axilla or the armpit called the talus spent, so you always want to check up there. And ideally you should do your breast exam every month, so that you know if something changes over time. Now, I do tell patients, if they don't want to do it, they have a partner or a husband that they can also teach their partner to do the exams. I've had 2 husbands now find their wives breast cancer, so I think it's really important to do it. So regardless of the technique, I think I was taught in medical school to kind of go in circles, but now I tell my patients to go up and down like the lawnmower. And then what you're looking for is anything that's new or different, or anything that's changed. I even tell my patients in their early 20s, to start doing their self-breast exams, because they get to know, how their breasts feel. So if something changes over time, they'll be more aware. Now, this particular model has 3 lumps, and so the answer key is on the back, so you guys are going to get the answers. So the first lump is actually the biggest one, and it's actually here. It's a big mass that represents fibrocystic changes. Now, women that have dense breasts or smaller breasts usually will have fibrocystic changes, and to me it feels like P's or BB's. And so when I'm doing a breast exam, if I feel that, I usually will tell my patient, oh, I want you to feel this so you know what it feels like. In most women, this is benign, but the reason we care about it, because sometimes if you have what's called dense breast tissue, it's really hard to pick up on a mammogram. So a lot of times I'll order an ultrasound or additional imaging for women with very dense breasts. And the second lump on this breast is the cancer. So it's actually the firm one. It's really hard, and most women can feel this one, and most people get this one right away because it's hard. What some women don't know is that you do have to press hard. So sometimes I'll have patients that kind of just barely touch the breast. But on this breast, you do have to press harder, and you'll feel the lump that's right there. And so that is the breast cancer. And then the third one, which most people don't feel, is the one in the nipple. And so this one actually is a plugged milk duct. So someone that may be breastfeeding, sometimes you'll get milk ducts that get plugged. They put this here around the nipple just so that you'll know to check the entire breast. And so this one is just a plugged milk duct. But it's super easy, something that should be done every single month. So I do advise my patients to do their own self-breast exams. And once they get in the habit of doing it, it's something that they do routinely. A lot of women do it in the shower. You definitely should do your breast exams standing up and lying down if you can, but I definitely want women to just consider doing the self-breast exams once a month. And it's part of their way to examine their breasts and to make sure that they stay in the best health that they can. All right, so next time we'll talk about mammograms, when to get them, and how often you should get them. So don't forget to press the subscribe button so that you can be notified when I upload a new video, and definitely want to keep you informed on all the new content that I'll be bringing out this year. So don't forget to hit that subscribe button. Thank you.